Hello, this is our presentation on levothyroxine for Dr. Ball's Pharmacology course, presented by Pedro Gonzalez.
Sam,
Rodolfo.
Thomas.
And I'm Paulo.
Yeah. So levothyroxine has many brand names, which include Hermeza, Euthyrox, Synthroid, and Levoxyl. It falls under the thyroid drug classification, specifically the hormone, and its drug pregnancy category is category A. Levothyroxine has not been shown to increase the risk of congenital abnormalities or miscarriage. Normal levels of maternal thyroid hormones are required for fetal development. So the mechanism of action for levothyroxine is it increases the metabolic rate in the body's tissues, increasing oxygen consumption, respiratory rate, and heart rate. It also increases the metabolism of fats, carbohydrates, and proteins, and enhances the growth process. Healthcare providers use levothyroxine as a replacement therapy for people with hypothyroidism. Other use include the following: treatment and prevention of youth thyroid goiters with pituitary suppression of TSH, management of thyroid cancer, prevention of goitrogenesis, hypothyroidism, and thyrotoxicosis during pregnancy, and also for the treatment of myxedema coma. Levothyroxine can come in capsules, solution, or as a tablet, and should be taken in the morning on an empty stomach. The dosage for primary hypothyroidism is for patients over 60. It should be 1.6 micrograms per kilogram per day. Patients under 60 is 25 to 50 micrograms once daily. For coma, uh, administration is IV initial loading of 200 to 400 micrograms as a slow bolus, followed by a daily replacement dose of 50 to 100 micrograms until patient improves clinically and can transition to oral therapy. The duration of treatment is it is meant to be taken for life.
Okay, so our first NCLEX question, it's going to be a nurse is educating a patient with hypothyroidism about the administration of levothyroxine. Which statement by the patient indicates a correct understanding of the medication? We just talked about this in the previous slide. The correct answer will be D, because taking levothyroxine with food can slow down the absorption rate.
Hello, my name is Rodolfo, and I'll be presenting the principles of pharmacology as well as the patient responses to the drug. So for pharmacodynamics, levothyroxine is a synthetic form of the thyroid hormone thyroxine, otherwise known as T4, which increases the metabolic rate in the body's tissues, oxygen consumption, respiratory rate, and heart rate. It also increases the metabolism of fats, carbohydrates, and proteins. For the pharmacogenomics, genetic differences, including polymorphisms in the enzymes and proteins that metabolize thyroid hormones, will affect the hypothyroidic patient's response to levothyroxine. The common homozygous type for DIO2, RS225014, capital T, and the mutant homozygous types for RS225015, capital G, were associated with higher levels of TSH compared with their other types. Therefore, the patients with these gene variations are going to have higher TSH levels and should therefore take a higher levothyroxine dose.
Okay, so for our second NCLEX question, a patient prescribed levothyroxine asks the nurse about potential Side effects, which of the following should the nurse include as a common side effect of this medication? The answer would be A. We just talked about it on the previous slide.
So for the pharmacokinetics, the absorption of levothyroxine when taken by mouth varies from 48% to 79%. Taking it on an empty stomach increases its absorption. Meanwhile, dietary fiber reduces its bioavailability. Thyroid hormones are greater than 99% bound to serum proteins, including thyroxine binding globulin, thyroxine binding prealbumin, and albumin. The primary site of T4 degradation is the liver. However, metabolism can also occur at the kidneys. Thyroid hormones are primarily metabolized through the process of sequential deiodination. The kidneys primarily excrete thyroid hormones. Approximately 20% of T4 is excreted in the stool, and the urinary excretion of T4 decreases with age.
So for our last NCLEX question, the healthcare provider orders 125 micrograms daily for a patient with hypothyroidism. The nurse understands that the primary purpose of this medication is to increase metabolic rate.
So some of the responses of the patient to the drug, for physiological, we should see normal growth in children, as well as normal blood pressure and heart rate, increased energy, no cardiac dysrhythmias, no insomnia, and no fever. Developmental, if a patient has untreated hypothyroidism, they're likely to exhibit stunted growth, poor mental development and intellectual disability, and delayed puberty. Therefore, patients, especially younger age patients, receiving levothyroxine should see improvements in these developmental domains. Psychological, some patients may experience anxiety and or insomnia while taking levothyroxine. Socioeconomic, since an underactive thyroid is a lifelong condition, patients would need to be able to afford the cost of lifelong treatment with levothyroxine. Cultural, some cultures disapprove of the use of traditional medicine, so they may not adhere to or even start their levothyroxine. Spiritual, some people may feel disconnected from their spirituality or religion while taking medication. Since levothyroxine is a lifelong treatment, they may feel disconnected from their belief in a higher power if they begin feeling hopeless.
Okay, so for the application for labs, the following will decrease when thyroid hormone is replaced. So they are serum cholesterol, creatinine, phosphokinase, lactate dehydrogenase, and aspartate aminotransferase. So when levothyroxine is administered, it'll enhance the metabolism of cholesterol, which is why it goes down. And for creatinine phosphokinase, when normal thyroid hormone levels are restored, muscle metabolism is improved, and that reduces muscle breakdown. So the CPK levels go down. And for lactate dehydrogenase, hypothyroidism is associated with altered energy metabolism, leading to increased LDH. And then the treatment of levothyroxine helps normalize metabolic processes, which can reduce the LDH levels. And finally, for the aspartate aminotransferase, levothyroxine can improve overall metabolism and liver function, leading to a decrease in AST levels. And so the hormone that we should monitor, that's very important, is TSH and FT4. So for TSH, the reference range is around 0.5 to 5.0. So if it's higher, it means that you may have an underactive thyroid, which likely means you have hypothyroidism. And then for T4, a low is indicative of hypothyroidism. And so to properly diagnose if you have hypothyroidism, we can do radiology. So we have a thyroid uptake scan, and Like many other procedures, we must remain NPO, no jewelry, assess for allergies, and the iodine-based contrast. And for the medication interactions, there are some medications that affect the effectiveness of thyroid. So we'll start with the ones that increase the effects. So antidepressants, adrenergic asthmatic agents, and nasal decongestants. And for drugs that decrease the effects, we have antacids, antihypertensives, estrogens, oral contraceptives, phenytoin, rifampin, and those lead to rapid metabolism. And okay, for assessing therapeutic effects to know if it's working, we must monitor increasing energy and diminished sleep, level of alertness and interest in the environment and surroundings, increased pulse rate and blood pressure, bowel regularity and decreased symptoms of constipation, reversal of coarseness of the skin and hair. So once all of these conditions start showing, it means the person is getting better and the treatment is actually working. But one thing to note is that thyroid replacement therapy is lifelong. Medical supervision is necessary frequently during early treatment and at least annually after the patient's condition has stabilized and maintenance dosage has been determined. And the brand of medication should also be consistent.
Okay, so when we look at evaluation for the health inequities for levothyroxine, um, specifically looking at age, you want therapy in adults and the elderly require necessary cautious treatment. You want to begin with smaller initial dosages and smaller drug increments at longer intervals than prescribed. And this is often due to the presence or previous experience with comorbid conditions and altered pharmacokinetics. And this ultimately affects their absorption and distribution, as well as metabolism of the drug, which can lead to reduced effectiveness or heightened sensitivity to effects. As for younger children, they often metabolize and experience therapeutic effects faster. Um, and this usually requires frequent dosage adjustments. When we take a look at gender, pregnant women with hypothyroidism often require an increase in levothyroxine dosage because of an increase in thyroid hormone demands during pregnancy. Um, it's also important to note that estrogen can affect thyroid hormone levels and the binding of levothyroxine in the blood. And then symptoms also vary with female and male. And then taking a look at race or ethnicity, um, obviously those who are in marginalized communities or non-English speaking may face challenges in healthcare, as well as understanding the plan of care, which plays a role in health literacy. And then expense also is a contributing factor. Okay, so moving on to the application. Our nursing scope of practice, you want to administer it orally. Monitor, of course, for adverse reactions, as well as patient education on basically what the drug is, proper administration, as well as any side effects for them to look out to. Taking a look at the legalities or rights, the patient has the right to refuse treatment, patient education, access to medical records, informed consent, and then it's also important that they know or understand transparency with the drug because it has a narrow therapeutic index. Taking a look at drug standards, you want to adjust dosage based on parameters regarding age, weight, and gender. Um, it's sensitive to light, heat, and moisture, which can affect its therapeutic effect. Um, you want to maintain the potency under proper storage conditions. And then taking a look at ethical standards, you want to inform or educate the patients about basically the risks, benefits, and side effects of levothyroxine, advocate for the patient regarding their treatment, as well as beneficence.
My name is Thomas, and I will be presenting the patient education pamphlet. So the most important things we want to teach the patient about this drug is that it adds thyroid hormone to the body, which helps to regulate metabolism, growth, and bone maintenance, and also plays a role in heart muscle and digestive function. So they will have to take this medication for the rest of their life, because this drug will provide the thyroid hormone that your body needs. So some adverse reactions that they should look out for are the signs of an allergic reaction, which could include rash, hives, itching, trouble breathing, swelling of the mouth, as well as signs of high blood pressure, which include bad headache, dizziness, change in vision, also chest pain, shortness of breath, change in weight without trying, fast and abnormal heartbeat, and feeling tired. So the patient should know that they should have all of their healthcare providers know that they take this drug. And it may take a few weeks before it does start to work, and should make sure that they do not run out of it. And if they have diabetes, they should speak to their provider about that and have their blood work checked frequently. So this drug is best taken, it's best to avoid taking as antacids, which could include like aluminum, magnesium, calcium carbonate within 4 hours before or 4 hours after taking this drug. Make sure to take on an empty stomach at least 30 to 60 minutes before eating. And it should be stored at room temperature in a dry place. Make sure to protect from heat and light. And if you miss a dose, just make sure to take it as soon as you remember. But if it is time for your next dose, then you could skip it and just try to go back to your normal time.
Okay, for our case study, we have Mr. Drizzy, who is a 45-year-old Mexican-American male with a history of hypothyroidism. He presents with fatigue, weight gain, and mood swings. He has been on levothyroxine 100 micrograms daily for 5 years, but feels his symptoms are not adequately managed. His background, he was diagnosed with hypothyroidism 5 years ago. Family history includes thyroid disease. His medication is the 100 micrograms daily of levothyroxine. He considers his lifestyle to be active. He moderately consumes alcohol. He adheres to traditional Mexican customs. So our assessment includes a physical exam. He is slightly overweight. His BMI is 28. No palpable thyroid abnormalities. His laboratory test returned with an elevated TSH level of 6.5, indicating inadequate dosing. So we recommend to request an increase of levothyroxine dosage to 125 micrograms daily to the provider, provide dietary recommendations focusing on more vegetables and whole grains while reducing saturated fats, and to educate Mr. Drizzy about medication adherence and the importance of taking levothyroxine on an empty stomach. Schedule a follow-up in 3 months to reassess TSH levels and overall symptoms.
Hi, Mr. Drizzy. We're here to discuss your thyroid treatment and make sure you're feeling your best.
Thanks. I'm just really tired and frustrated with how I've been feeling.
I understand, Mr. Drizzy. I reviewed your recent lab results and your TSH level is elevated at 6.5, which indicates that your current dosage of levothyroxine isn't quite enough.
And what does that mean for me?
We're going to increase your levothyroxine dosage from 100 micrograms to 125 micrograms daily. This adjustment should help reduce your symptoms of fatigue, weight gain, and mood swings.
It's also really important to take your levothyroxine on an empty stomach. So ideally, wait at least 30 minutes before eating or drinking water. This helps your body absorb the medication better.
Okay, I'll remember that. What else should I be doing?
We want to make sure you're also focusing on a healthy diet. That's where our dietitian can help.
Hey, Mr. Drizzy, I'm here to talk to you about some dietary changes that can support your thyroid health. You want to increase your intake of vegetables and whole grains, and it'll be beneficial for you.
I like vegetables. Any specific ones I should focus on?
Yeah, absolutely. So you want to focus on leafy greens like spinach and kale, along with colorful vegetables like bell peppers and carrots. They are also great choices. Whole grains like brown rice and quinoa will provide more nutrients and energy. It's also good to limit saturated fats found in red meats and full dairy products.
That sounds doable.
And just a reminder, there are some common side effects to watch out for with your medication, like headaches or changes in heart rate. And if you notice anything unusual, please make sure to reach out to us.
What about my multivitamin? I take one daily.
That's good, but be cautious with calcium or iron supplements, as it can interfere with how well your body absorbs the levothyroxine. Just make sure to space them out by at least 4 hours.
You would also want to stay hydrated. Drinking plenty of water is essential, especially with your meals.
We'll schedule a follow-up appointment in 3 months to check your TSH levels and see how you're feeling overall.
Okay, thank you all for this information. I feel more hopeful about managing this.
You're welcome. Remember, we're here to support you every step of the way.
Don't hesitate to reach out if you have any questions about food or nutrition.
We'll see you at your follow-up, Mr. Drizzy. Take care. And these are our references that we use for this presentation. Thank you for paying attention.